All right, welcome team to Plastic Surgery Untold, greatest podcast in the world as voted by us. Today we're going to talk cellulite. I know that we've talked about this before, but there's some new exciting treatments out there, and overall always evolving frontier. So this is super exciting. We also have a special guest that we're going to get to in just a moment. But before we get to our special guest, let's talk to the lovely Sarah, see what's going on with their life, and then we'll get into the nitty gritty here. Sarah, number one.
Well,
I was just wondering who was going to answer when I said that.
Well, we came prepared. We figured that we would mention something newer in both of our lives in relation to cellulite, which is that we were very, very lucky and blessed to speak for a national sales meeting for Avéli recently.
Yeah. It was super fun. Y'all actually Zoomed us in. So we were in Austin. Y'all were, remind me where you were.
Chicago.
So we got to speak about why we love cellulite, how we,
You love cellulite?
Well, we love cellulite treatments.
Okay.
Yeah.
Yeah.
Good correction.
We love cellulite because we know how to treat it. That's why.
And it brings us lots of amazing patients. So, but yeah, and what's been successful for us and why we love Avéli.
It's been super fun.
What else is going on? Anything else personally? Anything?
Well, we started school, so we are.
You don't want to share that with the world?
Well, we were saving it, but we'll bring it up now. Thanks for, ruining the surprise. Go ahead.
So we both started FNP school 5 weeks ago. We just finished our first class yesterday.
Yeah.
And
And I heard you both got an A.
we are straight A students. So.
Of course.
We're about
Shocker.
to start advanced pathophysiology, so stay tuned. We'll see if we still have an A in December.
Exactly.
we may have to get Dr. Weinfeld to tutor you guys.
Yeah,
Please, Dr.
Please.
Weinfeld.
We need help. Can I phone a friend?
And then we're so lucky to have Caro come join us, who's the CEO, president of Revelle Aesthetics, which has Avéli, our new cellulite treatment. We're going to get into exactly what this is, which is super cool because it's taken some of the things that have been there in the past and basically taken it to another level in terms of precision, I think, and being able to be very, very consistent, which has been a chronic issue with cellulite treatment and why a lot of people are frustrated and almost hesitant about treating cellulite, because I think most people who've had cellulite issues have been frustrated by treatments that haven't worked in the past.
Yeah.
But before we get into it, tell us a little bit about you, a little bit about the company, how you got involved, and thank you for taking time out to come join us.
You're so welcome, and thanks so much for having me. So I'm Caro, short for Caroline. I'm the proud CEO of Revelle Aesthetics, a company that was founded to really solve for that really complicated issue, right, that most of us women have, which is cellulite. So I joined the company right when it essentially came to light. So the device was born out of a medtech incubator out of San Francisco, Silicon Valley. There, a group of engineers had been really studying the issue of cellulite and trying to figure out why is nothing working? What makes it so complicated to treat? And so they had really been working in stealth mode for numerous years, really studying the underlying anatomy, which is the complicated part. And they made a couple of really awesome discoveries and then started to work on various different devices. And so came up with a winning concept. And at that point in time, they knew they were sitting on something really special that might actually start changing the standards to treat cellulite. And so then I was lucky enough to find my way to that incubator. I had been working in aesthetics for many, many years. So I started at a company called Allergan, so the makers of Botox. And
None of our listeners have ever heard of it.
No, nobody.
Sorry, what is that?
But all joking set aside, back in the day when I was introduced to Allergan, Botox was a small little sort of biologic, and people didn't quite get it yet. It hadn't been launched for
But you're
aesthetic
like
purposes.
29. I don't even know how that's
So my
possible.
whole childhood there. So anyway, that was sort of my step into medical aesthetics. And obviously, as women, you get very passionate about this field very fast. And I had the good fortune of sort of really being at the brink of kind of the launch of Botox Cosmetic. And then we acquired dermal fillers and so on. And so I ended up staying in the field for 20 years. I also spent quite a bit of my career in plastic surgery. So in 2008, I believe, one of the kind of tasks that was landed on my desk was to help bring silicone breast implants back into the United States. So anyway, so I've had a lot of great experiences. And so when this opportunity to try and solve for cellulite came to me, I was very fast to jump on it. And here we are.
I think, and if you don't mind, maybe we'll back up just a touch, because you hit on a few concepts, and a lot of women have cellulite, I think a lot of people blame themselves. A lot of people think that, that they have control over their cellulite. And maybe we have a tiny little bit of control over some of this with diet, exercise, those things. But there is a lot of factors that we have zero control over in terms of genetics, hormones, those things that predispose it. And sort of like when we talk about breast asymmetry, that over 90% of women have some. That's true for cellulite. Yeah. More people than not have this. The vast majority of women have some cellulite. And so I think people beat themselves up about it, and it's actually something that the majority of women have at least to some degree.
Yeah, I think that's absolutely true. And, to Sarah's, we talk about this all the time, ask any girlfriend, do you have cellulite? Yes or no? Very rarely will you find somebody who says, I don't have it, right? Because that's true. 9 out of 10 of us have cellulite. And the complicated part of cellulite is that it can be triggered by so many things. Mm-hmm. It doesn't really have anything to do with kind of weight gain or just aging alone. It can be anything, hormonal, genetics, you name it. And it just kind of happens post-puberty. And so it is unlike a little bit of a wrinkle that can be charming occasionally, right? There's nothing charming about cellulite. And in fact, a lot of studies show that. It's quite embarrassing. And so women do so much, right? We do creams, we do exercise, and we all just want it to look a little better, to have some smoother skin. And so we did quite a bit of research to kind of understand, how does it make a woman feel, right? To have cellulite, something that seems so, is it significant? But in fact, it's quite emotional for women because they're embarrassed, it really restricts what we wear. Many of us wouldn't be too comfortable wearing really tight pants or light colored pants because that would show kind of the irregularities on the skin. So, the data showed it's quite restrictive. And quite honestly, personally, I felt that way too. So.
And as our Sarah's probably can attest to, fashion has not helped this because I feel like bikinis have gotten smaller. Yeah. I feel like leggings have become an everyday thing. Mm-hmm. So, the ability to hide and do some of this has become more and more challenging with some of the fashion wear.
Yeah, I totally agree.
Because you both are fashion forward.
Absolutely. Yeah. we like the little bikinis and the...
I learned all my fashion tips from Sarah, but I couldn't agree more. I feel like we see so many patients in the office that when we're talking about cellulite, they almost feel like they have to apologize. They're like, I should be working out harder. I should be doing more, you know, and we're the first ones to point out to them that actually, you probably, if you were dieting perfectly and you were working out every day, you would still have this. And I'm sure we'll get into why, but it's super common, more common than most people think.
And in our next episode, we're talking about these full luxury legs, total body comprehensive treatment that we're starting to embrace more. We're going to talk about this because it's become a big part of our fat transfer, Brazilian butt lift, the boom boom booty stuff because it's been such a process and it's such a genetic thing that people have at an early age. I think that there's even truly some underlying, restrictive projection factors to this. Because if you look at, the shape of the butt, it correlates with the amount of cellulite stuff and most people have had this since they were very, very young. And so I think, to really get people an aesthetic result they're going to love, you really have to take all these factors into account. And so while some people may say, hey, I'm not worried about the cellulite, I'm worried about the overall shape of my buttock. I think the days of considering all these things in isolation is fading fast, and you're never going to get the result aesthetic goal that you want if you're only thinking about these in isolation. And this is a concept and dream that you and I share.
A shared dream. And I think that's true, right? I think a couple of things. I think it's true that body is really the new face, right? Because 20 years ago when we launched Botox Cosmetic, people were really looking for a solution for kind of wrinkles and volume loss in the face. But now that's pretty well taken care of, right? With all the things you do so well, we use our toxins, we use our dermal fillers, skincare, energy-based devices, you name it. And I think if you then descend below the neck, kind of enhancement of the breast area is also pretty well covered today. And then if you go down towards kind of the midline, I think again, tummy tucks and abdominoplasties, that's also really great techniques for it. But below the waist, it's sort of still a big puzzle. And women kind of have to go on a scavenger hunt to figure out, what do I actually not like below the waist? Because it's complicated. It's not just cellulite. We also have kind of what we call adiposities or extra fats in certain areas. And then there's kind of the skin quality that also gives over time. And I think those are three distinct kind of areas that we need to think about.
And that's something that we're going to go into depth about in our next episode, because I think it's funny because we'll have people that come into the office and there's twofolds. One, there's treatments that just don't work. And we've all seen the infomercials of home remedies, other things. You'd be surprised what people tell us they've tried to treat cellulite. People come in frustrated. I think it makes it hard for us because, now when there are some good quality treatments out there, people are always skeptical for sure, because they've been burned so many times. Some people have literally been burned because they've been doing treatments that don't make any sense, or were sold on something that's not helpful, and walking through. Before we jump too much into this, can we talk a little bit specifically about what Avéli is and how the treatment goes? Because I think we've held people in suspense a little bit, and what's unique and different about it, because there's some treatments that were similar, but there's definitely a big leap forward in terms of precision, and I think, just being reproducible by the providers.
That, and I want to make sure we remind people what cellulite truly is and why.
Let's start there. That's an even better place to start. Thank you, Sarah.
I figured we could
That's
start
why we need
there.
you. Yay.
And then go into Avéli. So we talk about this all the time. Cellulite, those dimples that you see on the skin. Sarah and I are, all the time going over with our patients what is skin laxity versus cellulite. And we can discuss with you in office because most of us have a combination of both, and we'll get into that. But the cellulite is actually caused by these fibrous bands that are pulling the skin down, right? And some of those, we need them. They're structural. They support the skin. They hold the booty up. They hold up the legs. But some of them are super tight, and they're actually pulling the skin down. So whether you work out, add more fat, have less fat, eat right, the bands are still going to be there. So if you don't treat the bands, you're still going to have the cellulite.
Yeah, absolutely. And what I think I found that I love about Avéli is that it is pretty superficial as we go into the skin. And so it isn't anything that's deep, that's, a significant thing. With the treatment of Avéli, I feel like it's pretty well reproducible, right, when we go in to do the treatment. And so we know that we're actually treating the true cause.
Can you guys explain what Avéli is? Because I think once you kind of walk people through it, they're going to understand why you're talking about why it's consistent, why it's superficial, why you can make sure that you've actually cut these bands. Because these technology, and they sound like little changes, but they've actually been big changes that have made stuff more consistent and easier for us.
Yeah. Go ahead.
So I think it's a great explanation of cellulite, right? So for many, decades now, people have been trying to figure out what are all the factors involved in causing sort of these irregularities kind of on the surface of the skin that we call kind of dimples or depressions. And we know that the skin thins, right, over time. And we also know that the fat cells generally become larger. And then you've got these bands. And so generally in the past, the reason why so many cellulite treatments have disappointed is because people have tried to go after these little bands from the outside in,
right?
Really sort of trying to approach it kind of more superficially. But when we started to look at the problem of cellulite, what became clear is that these bands are actually really complicated webs. It's almost like a cluster.
Right. It's not just one little band.
Right. It's not just one little band that's sort of easy to kind of release and ease that tension. And so our engineers discovered that, wow, they're really complicated kind of webs. And they also differ kind of from area to area. So the bands underneath kind of a depression or a dimple in your buttock is different than in your thighs. And so that made them think, like, how should we effectively try to release them, if you will, if we don't really know kind of what it looks like underneath the skin? So that came then to the evolution kind of in a thinking, like, what if we could come up with like a little device that could help the provider kind of with expert hands to really kind of go underneath that skin very superficially, guide them to kind of the dimple, and then give them a way to first test, where are these bands? Are these the right bands? And then release them. But the most beautiful thing that they also wanted to do was, let's take out any guesswork. So can we create a device that when we give them the opportunity to first feel and see where these bands are and then release them, can we allow them to actually verify that that release is complete and that we're getting all the bands that are pulling down the skin before you move on to the next dimple? And that sort of led to discovery of Avéli, which is our device. And if you're wondering what the heck that name is about, it really stands for kind of advanced and verifiable. So it really is all about advancing kind of the standards in cellulite, and verifiable is to say, for the first time, it's not about guessing anymore whether or not you're treating it. You're really attacking the problem from the inside out, and in expert hands, give people the tools to really do the job well before you move on to the next depression.
I think you guys hit on so many important stuff. Like, I think it's only recently that we've really understood more of this complex web underneath, and I think super underappreciated, even aside from cellulite. These fibrous septi stuff is why even liposuction in these different areas can be super, super challenging if people aren't super cautious, because it's just a different attachment. On the flip side, in the past, sometimes people have just tried to carte blanche release all these attachments, and that can lead to serious problems, because some of these bands are there for a reason in terms of structural support. And so like anything in life, too much can cause problems and can lead to some skin laxity issues, some contour deformities, seromas, like just space, because you need some of those structures. And the idea is that you're only releasing the bands that are causing a problem and not overdoing it. The light guided is super easy. And it's funny when simple concepts are applied, because I think when things are too complex, they become very hard. And when you take something super simple and make it in a very manageable way, now it lets people, it's even in as a sports fan, people play fast when it's simple. And so something like this, it's designed, and its uniqueness and kind of coolness is in its simplicity of application that lets the provider focus on what areas need to be treated and releasing those, and not worried about this complex device that needs 5,000 assistants and 6,000 cords. So I think that is some of the real uniqueness of it.
Yeah, and I think that's what was nice is the way the device was sort of designed was it actually was created by people who knew nothing about aesthetics. It was hardcore engineers that really looked at kind of these problems and tried to kind of decomplex them, if you will, and sort of look for the beauty in the simplicity. And so I think today what that has translated to is we now have truly kind of our mission is to set a new standard in cellulite with Avéli. And, in the right hands, what that means is it's a one-time procedure. If you have it done in the right place, it should be a one-time procedure. And it's kind of the amount of time it takes varies on the number of depressions or dimples that need to be treated, but generally we'd like to say, it's about an hour. And it's under local anesthesia, so no general anesthesia. So we just numb the pathway, right, that we're going to kind of tunnel and do the procedure through. And we can treat depressions in both the buttocks as well as in the thighs. So that's kind of clinically what we can do.
I'd love to hear your guys' impressions, because I think one of the things that's been surprising for me is, one, how efficient the procedures become, and then how well patients have tolerated. Because if you just think about this, like, from a just pure, mechanical thing, I have this rod being stuck in my butt, like this does not seem comfortable. And that has not been our experience.
Yeah, go ahead.
I just treated somebody 2 days ago who actually asked if their friend could come in the room. And I think this is kind of a unique, interesting story. So she was in there while we were doing the treatment, which was fine. And afterwards, she couldn't believe how comfortable her friend was during the treatment. She was just sitting there chatting, doing emails, talking. So being able to see an outside perspective and just see how comfortable the patient truly was during the treatment was pretty nice.
Is it true that the patient was helping you swipe through your Tinder pages because you had to clear out a lot, or is that fact or fiction?
We were actually just discussing future surgeries.
Oh, okay.
Nothing like that. But Sarah and I like to take it as a really great time, since we're doing them before the BBLs, to sit and answer any questions the patient may have. And they're super comfortable during the treatment. They get to ask us all about recovery and things like that for when they come to see you. So I think it's really manageable. It's super comfortable, and it's a great opportunity to just educate the patient even more.
And that's something we're going to cover in our next episode is combinations, because Avéli can be done as a standalone, I just don't like cellulite treatment. Yeah. It can also be done, and probably going to become more and more in combination, because as Caro alluded earlier, there's a lot of things that cause us to not like the way that our butt, legs, lower extremities look. And so this is obviously treating one of the larger problems, but doesn't treat all the things that we may dislike. And I think that's where having an experienced provider is super, super important, to be super clear, because we'll stand you in front of the mirror and for good or bad, be like, hey, here's the spots that are going to improve. Here's the ones that aren't, and so sometimes, you mentioned it does a one-time treatment to treat treat the true cellulite,
Right.
but sometimes people need other treatments to help with other
Absolutely.
issues going on. And so we try to be super upfront and clear about what we can and come with a overall plan for you.
Yeah, that's what I was going to say. Like we talked about earlier, most people have a combination of skin laxity and cellulite, and we have treatment options for that. So we'll go into detail in the next episode, but we won't, tell you we can treat this and then you're stuck with the laxity.
Right.
We'll give you some options, give you some treatment plans, but also we're going to be super honest and upfront about what is going to improve and what is not, because we want you to be happy, and if you're happy, then we're happy.
Because I've seen you guys tell people like, hey, these are the dimples that I know I'm going to make better.
Right.
If that's going to make you happy, this is a great treatment for you.
Right.
If that's not what's bothering you and this isn't the issue, then let's talk about something else.
Right.
And, we'd rather you be a little disappointed in the consultation room before you spend a bunch of time, effort, and money than afterwards. So, and that's one of the beauties about this being able to be done when you're awake and so forth, because you're literally part of the process with us.
sure.
Yeah.
We'll talk about it. We'll mark you. We'll stand you in front of the mirror again in these fancy little paper panties that you will love, and then be like, and then you can say, hey, yeah, and then it's a chance for you to say, hey, what about these? And we can say, yep, that's the one that can be treated. Or no, that one's not because of X, Y, and Z, and we'll walk you through that.
Yeah, absolutely. We do that. I think our biggest thing is just really honing in on the assessment process, like you're talking about. We make sure the patient's involved. They're the one that looks at their booty every day. We don't. So we'll mark them initially with what we see, and then walking them to the mirror and saying, where is there another spot that you see every day that's bothering you?
Sometimes they see stuff that we don't see, or it's different lighting, and that's why, making it a conversation with the patient is so important. And then we all know what to expect too.
Yeah.
And has that been your experience? That because to me it seems like the longest and hardest part is this marking, is this discussion. It seems like an hour is about what it's taken. You guys, obviously, there's a little variation. If somebody has 5 dimples versus 30, it's going to take a little bit more time in terms of that.
Yeah.
Totally depends on the number of depressions. But yeah, around an hour, mark you, take photos, and then we have you take a look, make sure you're happy, and then we'll get started with the actual treatment, which Sarah mentioned, you're totally awake. We numb you with some tumescent fluid, local anesthesia. And we almost get kind of annoying throughout the whole procedure because we ask you a million times, you doing good? You doing good? Because if you have any spot that gets a little uncomfortable, we can add some extra numbing.
That's something I think we also found is taking the time to really be sure that they're numb before you start the procedure.
Yeah.
So we'll double, triple check even. And then the procedure itself goes super smooth after that, as long as they're comfortable ahead of time.
And then we can offer laughing gas if they want it too. Not a requirement, but an option just to help you kind of relax.
And what about from a recovery standpoint? What does that look like for people? Because I think the biggest thing is a lot of people are like, I just can't do downtime, those type of things. And then is there maybe a better time of year or not to do this? Or is all the time booty time?
I mean, we can technically treat all the time, but for sure, the fall, winter, spring is perfect time to take care of these dimples before we get back to our next hot girl summer. But recovery is minimal. You're going to drain that fluid that we're injecting a couple hours. Most of our patients have found they're totally done draining by the next morning. So do the treatment in the afternoon. We'll send you home with a little goodie bag, which I'll let Sarah go into in a second. But we'll give you everything that you need for that recovery process. We'll tell you exactly what to expect. You're going to drain for about 12 hours. We like you to avoid exercise for probably about 48 hours. But it's a pretty minimal downtime procedure. There's not even any stitches. We close up the little insertion site with steri strips. And then just to be safe, we have you stay out of any like hot tubs, lakes, pools for a couple weeks. But other than that, very minimal. And then you want to tell them about our little goodie bag?
So we put together a nice little goodie bag at the office. They go home with a pair of compression shorts just to help with any swelling and bruising. They also go home with topical and oral arnica. We have them take that just to prevent or help reduce bruising that they may have, which we noticed is significantly less
minimal
compared to other treatments. So that's really been nice. And then Avéli provided us with a really awesome aftercare sheet. It talks about day 1 to 2, 3 to 7, and then it goes even into 30 days, 90 days, what to expect. We send that home with them and kind of review it just so they know about possible things that could come up and how to deal with them.
Are most people able to drive themselves home? Do they have to bring somebody with them, or?
No, they can drive themselves. Outside of the Pronox, which wears off in a few minutes, there's nothing else that would inhibit them from driving. And by the time, if they do use the Pronox during the treatment, once we're done with the treatment, it takes us another 15, 20, even 30 minutes to, do the steri strips, go over post-care and all of that, and they're perfectly ready to drive home.
Can people go back to work the next day?
For sure. Yeah. Back to work the next day. Like I said, to be safe, we have you avoid, working out 24 to 48 hours, but We don't make you take any time off, head back to work the next day, and get back to your normal routine.
Yeah.
And then what do you think is a realistic time zone? Like if you're really trying to squeeze this in before, big bikini party, pool, party boat, barge, that type of thing. What's a safe amount of time? Because I know bruising's definitely less, but I always tell people it's you can't jinx us. It's like when somebody comes in for Botox and fillers and says, "Sarah, you never bruised me." You're like, okay, you just guaranteed you're going to get the biggest bruise of your life. What's realistic for people if they're trying to plan this in terms of recovery time, when they're going to start seeing results, bruising being gone?
I would say
not for any of our procrastinators out there.
At minimum, we want you to do this a month before any sort of event. I like to be safe. I'd always like you to maybe even do 6 weeks if you could. But just to be safe, like Dr. Franco was saying, everybody heals at a different pace. I would say, most people are looking really good after a couple weeks, but just to see your final results, let everything smooth out, let all the swelling go away, let any bruising that you did get, resolve. Would you agree about 4 weeks?
4 to 6 weeks.
Yeah.
And I think, that's another great time we can talk about on the next episode to go in with a secondary treatment if they need it. I think we definitely need to give them 4 to 6 weeks to see how well Avéli did.
And it's actually been super interesting to me, just someone who does BBLs, other cellulite treatment, like how little bruising the majority of the patients have had. Everybody's obviously is a little bit, different. But there's some patients we've had that they have like one tiny little spot, which to me is almost amazing that you can have so many. I think some of that has to do with the great job you guys do ahead of time, because there's some hidden nuggets in some of the stuff you do in terms of pre-treatment and getting them numb, some other stuff for another time maybe for us to go into that actually decreases some of that. And we're happy to share with that. If you want to slide into our DMs, we're happy to talk to people offline of some of that medical care that we do stuff. But I think it's super interesting in terms of that. Also, too, I think, we've talked about this in our scar management, being good partners. If you go out and you go to the gym that evening or you do something, very strenuous that's getting your heart rate blood, that's not helping your bruising. That's not helping your swelling. That's not helping your cause. So the better you can be about following your instructions, the quicker, better you're going to do.
Yeah. Yeah. And I think it's absolutely right. I think it is minimally invasive, but you have to be a good patient. And I think just apply some good judgment. And what we've also said, kind of, you might feel some soreness and then just take some Tylenol, sort of that's kind of recommended. But, by and large, it's really well tolerated. And we're seeing rapid and really nice results with minimal downtime. So.
We've talked a lot about buttock, but this actually can treat some of the thighs too. Can we talk a little bit about thighs before we wrap up? Because I think thighs is one of these that really drives a lot of people crazy because, buttock is great for, you're at the pool, you're at the party barge, those type of things. But thighs, especially with shorts and things like that, is something that are exposed for a lot of women a lot of the time.
In fact, when we started our studies, it was really kind of touching to hear all these women that were enrolling in our study just sort of saying, can you do something for my thighs? Because I haven't worn shorts in 20 years, and really.
And in Texas, that's tough.
Yeah.
Yes.
Right. We hear it a lot, though. I agree. All of our patients say the same thing.
Yeah, because you're right. I mean, it's so visible, right? Your buttock, you can kind of cover that up. But thighs is really restrictive if you really don't want to show off your thighs. And so we always say that, oftentimes cellulite is a misnomer in and of itself. People don't really know what exactly are we talking about. Is it laxity? Is it kind of a dimple area? And so we can treat with Avéli, we can really treat kind of any sort of skin depression, if you will, so long as what we say it has edges, kind of defined edges. And if patients come and see you, they're in perfect hands because you do your assessment beautifully. But we can treat very effectively the thigh areas. So the sides of the thigh, the back of the thigh. But going back to kind of what we'll talk about next is generally in the thigh areas, there's lots of other stuff going on too. And that's where you really need to go to experts like you guys to really kind of help make that determination. But if you've got some dimples on the sides of the thighs or the back of the thighs, we can treat those beautifully also.
And I guess one take home I would say from the thigh stuff is don't let your body keep you from wearing what you want to do. I feel like we're way too hard on ourselves.
Yeah,
it's never as bad as you think it is. I promise.
No, I love that point.
But one kind of thing that was so important to us. So the company that makes Avéli is called Revelle, and so we decided to land on that name because it's kind of the blend of reveal and L in French, her. So reveal her, because for us it was all about sort of our mission mission is we're all in the business of helping women reveal their true self, right? So help them feel confident and comfortable in their own skin. And that was it was all about. And so going after cellulite was really appropriate for us and obviously for the company. So
what are some other little nuggets, insider tips you would like to tell people about cellulite and specifically Avéli treatments?
One thing that I really think is awesome is that it's light guided. The device that we use itself, so it helps for precision. So if if you're somebody that's worried that other treatments have failed before and things like that, I think it allows the provider to exactly know within a certain region that we're treating the specific area, and I think that's really awesome.
And like we touched on earlier, actually verify it. I like to call it my cellulite magic wand. But essentially, treat the dimple and then go back and verify that the dimple is truly gone. Because as you know, when you stand up, you can see the cellulite easily. When you lay down for the treatment, it looks like you don't have any cellulite. So that's why the marking is so important. And then being able to recreate the dimple with the Avéli device before you release the bands and make sure that you're truly treating within where you marked, right? Because like we talked about earlier, you don't want to release too much or you can run into issues. You don't want to treat areas outside because then your dimple will still be there. So just the precision and being able to verify, like Sarah said, and the fact that typically it should just be a one-time treatment is just so awesome. And
I think it gives you a ton of confidence as a provider that you know what you're doing is going to be effective. And it's really exciting to see those patients back and see how great the results are.
And I think the other thing, and we touched on it, was, it can be done as a standalone treatment or in combination because a lot of people are doing other things, whether it's butt implants, BBLs, fat transfers. We'll help you walk through the timing because there is a window before and after because obviously we want you to heal. We want you to do well in terms of this. And so we'll guide you through that. Definitely, if you're getting different treatments at different facilities, definitely be upfront with them because we're happy to talk to your other providers and those type of things, but we want to make sure everybody's working towards your aesthetic goals.
Absolutely.
Yeah. And if you already had a BBL in the past, it's not too late. We can treat you after as long as you've been, healed long enough. So just those of our patients that we didn't have this in the past and they still want to go back and treat that cellulite, we can see you too.
And we've seen patients who have BBLs done in other practices out of the country, and have come and been like, and this is where it goes to I think a misconception because the BBL adds volume, definitely can do a lot of great liposculpting, shaping stuff. But sometimes when people are looking at, I think the idea of BBLs or Brazilian butt lifts creating this just only this big old massive booty has faded by the wayside, and now it's more of this overall shape from your waist to your butt. And part of shaping the butt is contouring it because we get so many people now that they're like, I want to improve the shape. I don't necessarily want this intense volume. And so I think sometimes people say this, and it's our job to help kind of work them through how do we improve this overall shape? And sometimes it's multiple treatments, including something like this.
Yeah. And I think that's a good point, right? I think that what maybe is also important to stress is that treating the body requires a lot of finessing, and I think that therefore it's not just about finding good products, it's also about going to people that have really amazing techniques like you guys. You guys are excellent in your craft and because you study it so well anatomically and you really think very carefully about how all these pieces of the puzzle fit. But at the end of the day, it wouldn't matter how good Avéli is, your technique has to be superb. And so now you see all these cool technologies that are super targeted in what they do, but they still come with a really kind of detailed kind of playbook, right? And so I think going to, practices that really have this technique down is very important because they're complicated problems that really need a very sharp eye.
And it's interesting because your company has taken an approach where you've selected a few providers around the country to start. And the idea is that hey, we're going to start with people who have really focus on this type of the body, on buttock stuff, on these type of treatment stuff, and then slowly evolve and roll this out to more and more practices as you kind of partner with practices to develop best practices and making sure that because obviously it doesn't do the patient, you guys, or us any benefit if people aren't getting the results they want. And so, we're fortunate to have the Sarahs that are helping kind of make sure all these things in terms of the goodie bags, the evaluation stuff are getting people to a goal.
Yeah, I think it's an excellent point. So, because because there has been so much failure in cellulite, right? I remember when the engineering team, I was introduced to them and they said, we have the holy grail in cellulite. And they were kind of joking. And I was almost rolling my eyes, right? I was like, sure you do. But I think we knew once we discovered kind of really how neat our technology was and that it could actually, for the first time, do the job well. We also recognized that we would be bringing this product to market when there had been nothing but failure and a lot of skepticism and a lot of cynicism, because we've all tried the lotions and potions that promise everything. And we may have also tried other treatments in aesthetic practices that didn't do the job after thousands and thousands of dollars. So for us, it was very important that we would really kind of, earn our clinical stripes and really prove our worth from the start. And we're only as good as our last case. So we really wanted to go to physician practices that really were meticulous, that were really detail-oriented, and that would really be good partners and learning how to do the procedure very well with a lot of detail and a lot of patience. And so I think that's been kind of our formula for success. And it's such a privilege working with you all, and I can't wait for more patients to come and see you because I think your work is excellent. So
thank you.
We
so
really
much.
appreciate that. Thank you for coming to see us.
Oh, you bet.
Do you guys want to do a little behind the bovie? Any other little nuggets? I feel like we've shared so many nuggets.
I know,
We've shared so
gosh.
many.
Maybe a quote of the day?
Sure.
You had a great one last time, so no pressure.
I have one more.
Okay.
Lucky for you. I think
And the listeners.
That's right. I think it's perfect because I didn't know the meaning behind Revelle, but this kind of is a play on that. So this is from Coco Chanel. Beauty begins.
That's interesting. That's who you chose.
We're all about beauty.
Beauty begins the moment you decide to be yourself. So. I think, treating cellulite and getting, a play on confidence, we talked about that last time, just helps you kind of play more into who you are, not being afraid to wear whatever you want and stuff like that. So, yeah.
I think that's perfect.
I love it. I just want to thank you for coming to see us again.
Thank you.
And hopefully you're going to stay. We got another episode coming up soon. So we'll catch all you guys in just a few minutes. Thank you guys for coming out on your Sunday. Appreciate you all. Don't forget, you can download Plastic Surgery Untold wherever you get your favorite podcasts, iTunes, iHeart, Spotify. And if you want to see us, you can watch us on YouTube as well. So catch you guys soon. We'll see you in a little bit. All right. Bye.
Bye, guys.